Hello, good evening, everyone. Welcome to my Fences and the European Fertility Society. We are back once again with another topic today and two special guests this time. So I'm really happy to have you both here. This is your first webinar on our platform. So I'm really happy to see some new faces as well, because we are here almost every single week. So it's always nice to have someone new and to talk about many different topics. And today, we will talk about pre-implantation genetic testing and egg donation. I know that this is a topic that is all sometimes very controversial. So I'm really happy that we are going to discuss this as well. And as you can see, Dr. Serafim Pusias is with us, and Dr. Sofia Trahana is also with us from My Fertility. Both of them are gynecologists and obstetricians, fertility specialists with experience, definitely years of experience. I'm really happy to have you both here. How are you feeling today?
We're fine. Thank you very much.
Thank you so much for joining.
Thank you very much for the invitation.
Glad to have you both here. And as I mentioned, today we will talk about not an easy topic as well. So I'm really happy that we will be able to discuss PGT-A and egg donation, and then both Dr. Serafim and Dr. Sofia will discuss how it works in Greece, of course, as well. And they will introduce some legal aspects as well, which is definitely important. And we will start with the presentation on the topic, but afterwards there will be time for your questions. So as always, please put those in the chat so that Dr. Serafim and Dr. Sofia can answer them for you. Remember that the presentation will take approximately 30 minutes, and afterwards we will have 30 minutes for your questions. So don't hesitate. This is all anonymous. It's also being recorded. So you will have a chance to rewatch this again, and it will be available on our website, My IVF Answers. And now I think it's best to go ahead with the presentation. I'm sure you are definitely interested in our topic, so I think we can start with the presentation. Are you both ready to discuss it?
Yes, of course.
Brilliant. Thank you so much then. Let's go.
Okay. So, as already Carolina told, I am Dr. Serafim Pusias, and today me and Dr. Sofia Trahana will present you about PGT-A and egg donation. First of all, my topic will be PGT-A. PGT. What is PGT? PGT is a DNA investigation of the embryo. It's a pre-implantation genetic testing that is used during the IVF to screen the embryos for genetic conditions. And why you use it? Mostly to detect abnormalities or structural abnormalities of the karyotype or of the number of the chromosomes of the embryos. And of course, to prevent hereditary diseases. What types of PGT there is? There is PGT-A for aneuploid screening. Aneuploid is for the normal karyotype of a person carries 46 chromosomes. Aneuploid is if the number is above 46 or below 46. That is why we're using it. PGT-M is for monogenetic diseases screening, that the parents they are carriers for some diseases and they give it to their offspring. And of course, PGT-S are for structural rearrangements that are causing a non-healthy embryo. How it is performed? It's quite simple. First of all, we do the IVF procedure. We stimulate the ovaries. Then we perform the oocyte pickup. We fertilize the eggs. And then on the day 5 on the embryo, when there are blastocysts, we perform the biopsy and we extract some cells from the trophoblast from the embryo. Here we see that the embryo biopsy is performed on day 5 or 6 when the embryos are blastocysts at this stage, and then we will see how some cells are extracted. Then the cells, we send them to the genetic lab, to our facility to perform the investigation that is needed. So, and after what we're doing, the results come and we see which embryos are healthy and which are not. We exclude the non-healthy embryos and we perform the embryo transfer only with the healthy ones. That give us an increasing success rate. The cumulative success ratio for three embryo transfer with a single embryo that is euploid and healthy is almost 60%. And of course, it reduces the risk of genetic disease. The benefits, of course, is to improve, as already said, the IVF outcomes, to reduce the miscarriage risk, which is very common, and the most common miscarriage risk is etiologies for unemployed of the embryo, and of course, a healthy baby assurance. Of course, the healthy baby assurance comes also during the pregnancy with the prenatal testing, that is almost also important. What are the limitations here? Not all conditions are detectable. We can, as already said, the success ratio after three embryo transfers is almost 60%, but there is no guarantee of pregnancy. And of course, the cost to perform PGT investigation is a little bit higher. As already said, the prenatal testing is also important during the pregnancy because we have to be sure that the baby, yes, of course, we did the PGT or PGT-A, M or SR, that we have a healthy embryo, but we have to be it has to be confirmed due the prenatal testing. So, to take home message, PGT is a powerful tool, helps and ensures a healthy pregnancy. And of course, the most important part here is a consultation from a genetic counselor. In Greece, what are the indications and the Greek legislations? First of all, if a couple has two or more first trimester miscarriages, if the woman is equal or above 40 years old, if she has three or more failed IVF cycles, then she can take the license for PGT-A, for unemployed screening. As I already said, for unemployed is only for the number of the chromosomes. Or when she has a pathological karyotype and we see structural chromosome abnormalities or abnormalities of the sex chromosomes, so diseases like Turner disease or Klinefelter's or unemployed, then she gets the license to perform PGT. The most important here, if a couple has already a child that needs a donation, bone marrow donation or a stem cells, we select the embryo that is a perfect donor for this sibling. And it's very helpful for the future for both the children. And of course, if the parents are carriers for monogenetic diseases or chromosomal rearrangements, then we perform PGTM, and with this we exclude some examples of monogenetic diseases are hemophilia, fragile X, cystic fibrosis, beta thalassemia, and of course, we can exclude late onset diseases such as Huntington's disease or hereditary cancer. And that was my part about the BGT, and now Sophia will go on.
So, hello everyone. I'm Dr. Sofia. I'm a consultant in obstetrics and gynecology and fertility specialist. And today I will present you about egg donation. So, what is egg donation? Egg donation is an option for women who cannot conceive with their own eggs. Although the eggs is from donor, allows the woman to carry and deliver a pregnancy. So maybe the genetic material is not ours, however, the pregnancy and the delivery is ours. It happens in our body. Who uses egg donation? First of all, women with poor quality of eggs. Women with no ovaries but an intact uterus. We need the uterus to be normal. Women with genetic factors that they do not want to have their offsprings, like very serious health problems. Women with failed ETs with their own eggs. According to the guidelines, we recommend to a woman that she has almost 10 embryo transfer with her own eggs to move to donation. Women of advanced age, usually ladies above 45 years old, our proposal is to move to egg donation. Egg donor requirements. Of course, for a woman, in order to be a donor, we need her medical history, her psychological profile, a lot of medical examinations, and an ovarian reserve assessment. According to the law, egg donors are young and healthy women between 21 and 31 years old. Here is an example of some tests that the donor should undergo in order to be a donor. All these tests are determined by the law. The most important of them, if we can say, it's karyotype, cystic fibrosis test, the fragile legs, the spinal muscular atrophy, because they are usual in the worldwide population. The procedure of the process of egg donation. The donor will take some injectable drugs to stimulate her ovaries. She will do exactly the same process that a woman will do in order to have IVF. Once her egg are ready and mature, the doctor will do the egg collection. This is a procedure under sentation. The egg are fertilized in the laboratory by the recipient's partner sperm or selected donor sperm. We can use both of them. And the embryo or embryos are transferred into the recipient uterus. So, in Greece, the egg donor is totally anonymous. Exception is very close relative like sisters. But even in this case, we need a special license from the Hellenic Authority of Human Reproduction, and mainly when the known donor is above 35 years of old. What we are doing in our clinic, in My Fertility, we have collaboration with some Greek egg banks. Usually the doctor chooses the donor depending on the recipient's requirements. No photos are available, no name is available. The recipient can have information only for donor's medical examination by the doctor. We can't provide information about the family history. We can't provide any other information about education or anything else. We also have collaboration with some international egg banks. Some of them is Ovobank and Cryos. The recipient can choose the donor by themselves. Donor photos are available to recipients, but not the name, of course. Donors' medical examination are also available to recipients, are open so they can see the results. Recipients choose their donor, they pay the egg bank for the donor, and the International Egg Bank sent the eggs to Greece. So all the procedure is totally transparent. Fertilization of the eggs can take place in Greece, and embryo transfer also take place in Greece. The International Egg Bank can guarantee 1 or 2 blastocysts, but unfortunately for an extra cost. So, according to Greek legislation, women between 50 and 54 years old need special license from Hellenic Authority of Human Reproduction. Please bear in mind that 54 years of old is the upper limit of age for any kind of fertility treatment in Greece. The success rate. This is very important. Success rate with donor eggs is up to 60 to 65%, is not 100%. Okay, this should be clear. And this success rate, depending on the quality of sperm used, the donor's age and egg quality, and of course the recipient's overall health. So, a take-home message. It is estimated that over 1 million children are born worldwide every year as a result of IVF with donor eggs. Please think, maybe yours. And this is us. My name is Dr. Sofia Paraskevitra-Hana. My colleague is Dr. Serafim Pousias, who you can contact for My Fertility. Thank you very much.
Thank you very much.
So just wondering, what are the chances of conceiving with donor eggs? Had failed rounds of IVF previously and one failed round of donor egg, but since that I have had 2 surgeries for stage 4 endometriosis, recently had bowel resection for endometriosis. Would I have better chances now of egg donor success? Age, as you can see, 44. Anything you can advise? Would like to go first?
I can go first, and then Sophia will add something. First of all, the endometriosis is the cause for infertility, the main cause. Endometriosis is toxic for the eggs itself, poor quality eggs, poor quality embryos, and of course for recurrent pregnancy losses. That's why when we see that and we extract endometriosis, of course, stage 4 is a severe case of endometriosis. I can guess that there are no more ovarian reserves there. So, of course, with donor, if she already has the procedure done to extract endometriosis, then the percentage for the success ratio with donor eggs are very, very high and similar to the others. Of course, here we have to be careful about to choose the correct protocol for the embryo transfer. Sometimes we use a different protocol with women after a surgery with endometriosis. It's not the same protocol that all the other women uses.
Okay.
But overall, the success rate will be mostly the same if the endometriosis is already extracted.
Okay. Anything
So
else?
I totally agree with Dr. Serafim. Endometriosis is a very severe condition for fertility. However, this lady had egg donation, so it's not a matter of the poor quality of the eggs now, but it's a matter how her body reacts to endometriosis. She has severe endometriosis. And the first thing that I think, of course, she should have done so far, to check inside the uterus, to have a hysteroscopy, to check the baby's room, if everything is okay, in order to transfer the embryo. And I think that if she insists a little bit, maybe 2 or 3 cycles, she will have her baby.
Okay, that sounds good. Thank you so much. And let us know if there's anything else you would like to ask. Of course, we are here for you. But I do believe it was helpful already for you as well. And let me go to the next question, this time from Katy again. As you can see, quite a few details. So last November, we had a fresh embryo transfer with donor X, which I needed to have GnRH injection for prostate implantation failed. Since then, I have been experiencing anovulatory cycles, no LH surge detected on ovulation test. I did not have this issue prior to the injection, as I would get an LH surge in every cycle. Could the injection have caused this problem? And which has been going on for 7 months now. What could be done to get spontaneous ovulation back on track? Age 42.
So first of all, it's regarding which generates injection did she do. There are different types that covers for ovulation for 1 month, or they suppress the cycle for 3 months or 6 months. If she has done a blood transfer
1 month.
or once,
Katy added, yeah.
if she has done only one generates 0.1, then she should check her hormone status in order to see, and some other endocrinal status such as steroid or prolactin, to see where she's at, why she's having anovulatory cycles. But the injection itself, if it's only 0.1 only for 1 month, it's not responsible for this missing LH surge after 6 or 7 months. Usually, after 2-3 weeks, the organism itself goes on and the cycle begins itself. But first of all, she has to do the examination to see her hormone status overall.
I totally agree with Dr. Serafim, and I just want to ask how she find her ovulation, just with the test, the ovulation test, or is she doing some blood test? Because maybe sometimes we don't do the ovulation test in the correct way, first of all, and sometimes we may miss our ovulation. So maybe if she wants to be very, very sure if she has her ovulation, she needs to perform an ultrasound and some blood test just to be sure.
Sure.
On the other hand, Dr. Serafim is absolutely right that it can't be a result of the injection for 7 months.
But I have to
Mhm.
ask, usually we don't, when we're doing a fresh embryo transfer, we don't need use of ovulation with generates.
Yeah.
This is something there. It's when you use induction ovulation with generates, it is a frozen cycle. We don't perform an embryo transfer because you have a luteal phase defect. That's why I think she may think one day after the embryo transfer, did she do generate take injection? I don't know.
First. Thank you so much. And of course, if there's anything else, you can follow up right here as well. If not, remember there is also an option to get in touch with Dr. Trahana and Dr. Pusias, and I'm sure they will be happy to help you out, of course. But thanks a lot for answering that question. I know that it's really sometimes difficult to answer properly as you have only little information and you would need definitely more. But thank you so much for explaining, and I think that was already useful as well. And now let me go to next question here. What countries allow PGT tests without having to apply for licenses?
Okay. So I have worked in Germany, Austria, and Greece. All of them wanted a license. Sophia?
So, because I know a little bit more about the law, and I don't think that there is a country that legally can offer PGD without a
Without a
license.
license.
So,
Yeah.
unfortunately, we need the license. In Greece, they are thinking not to have a license only for PGT-A, but it's not formal so far.
Mm, okay.
So,
All
but
right.
there is legally there is no country that they allow PGD without license really.
Because there are
Mm,
some ethical considerations. An embryo is a living,
Yes.
it's considered some of the child. So in order to do something, it's a genetic material, it belongs to the parents, so there is need to be a license in order to do some tests to it.
all right. Thank
Even
you so
though
much.
it's a lab, it belongs to you.
Right. Sure. Of course. I think
And
that's clear.
And I'm sorry, to the best of my knowledge, in Greece, it is a very easy way to take the license. My experience with UK and other countries in Europe is that it is very difficult in other countries to take a license for uh,
Mhm.
genetic testing. So yeah, it's a thing. It's a problem.
Okay. Thank you so much. And let me see. There are more questions coming up, of course, right here.
I just
Uh,
want to add something.
yes, go ahead, of
The
course.
Greek, the Greek legislation always says for women above 40, they can do PGT-A.
Hmm.
All
Yeah.
the indications are or two or more cycles, or above 40, or miscarriages. Not all of them together, they have to be fulfilled, only one of them.
Right. Okay. Thank you so much indeed. Um, okay, so I am above 40. I can do PGTA. This is the just to confirm.
Yeah.
Yes.
Yes. Okay,
Only with
perfect.
your identity, just an
Yeah.
application and your identity. And you will take the license within 2 weeks.
Suma.
Okay, thank you. That's what we wanted to make sure, as there was a follow-up. So thanks for the reassurance and thank you for clarification. It's really important that way to know. Okay, if you find out that the donor's embryo failed PGT-A, what is the procedure?
Do you, do you mean
But
that the embryo is unemployed?
I believe so, yes. I would, that's what I would think about it. But of course, if Boris, if there's anything else, of course you can type this in, but I would say that, yeah, no,
If it
unemployed
comes
embryo.
from international bank, I think already Sophia said that there is a guarantee for embryos, but if it's failed due to unemployed because they check the karyotype of the donor and here in Greece, so it has to be from the sperm. That's why I said when we do PGT-A sometimes or to the donors and we have failed, we have to check also the man.
Mhm. Right.
Okay.
And then we
On
can use sperm donor. So yeah.
So, on the other hand, the donor is very young, is between 21 and 31 years old, but there is no guarantee that she can't have unhealthy embryos, unemployed embryos. So, if the embryo is unemployed, you don't transfer it, you move to other embryos, maybe with another donor, or maybe with the same donor but other embryos, other oocytes, other embryos. I know I totally understand about the cost, but unfortunately, there is no guarantee that the donor's egg will give you an unemployed embryo. The possibility to have an unemployed embryo is very low. However, it exists.
Exactly. And that's why I wanted you to see there's a follow-up. So do you take that donor out of the system, yeah? If you see that, a
Yeah,
donor
yeah,
has
of course,
unemployed embryo.
of
Exactly.
course.
So I think it's important to again repeat that. But as you said, even donor donors can create unemployed embryos, right?
Yeah, because a young woman, let's say a woman 21 years old, in every cycle she produces okay one egg, but she has a chance 24% to get pregnant. After 6 or 8 months, she has 80%, but not 100%. And that's because not all the eggs are correct and healthy. Okay, always we have the system we have a limit. There is no 100%. Even though you are 20, 30, 40, of course, above 35, that ratio increases exponentially.
And we have to be absolutely honest to the patient. The donation has a success rate of 60 to 65%. It's not 100%. And of course, with donor eggs, we have some unhealthy babies born. However, this
Sorry.
possibility is very low. That's why we say that with a woman of advanced reproductive age, it's better to use donor egg because donor egg the possibility to have an embryo with a problem or an unemployed embryo if you test with PGT-A is very low if we contrast it with her own eggs. But of course, there is no 100% success rate.
Yeah, let's say we have a donor and a woman orders 10 eggs from this donor. Okay, and then she has, let's say, something amazing, and she has 10 embryos. Of course, according to the statistic, one of them will be unemployed, but that
Mhm.
doesn't mean that the other are not healthy.
Yeah. Okay. Thank you for the reassurance again as well. It's important to mention that. So yeah. And let's have a look. Next question is up. Tamata would like to ask, so you mentioned that PGT testing is 99.9% accurate. Is it still applicable for embryos obtained at age 44, 45? What is your experience? The euploid embryo obtained at age
Yeah.
44, 45 leads to healthy live birth.
So the accuracy of the PGT-A is independent from the age. The unemployed ratio that is depending on the age of the woman. Okay, so around 44 and 45, the ratio to get employed embryo is around 5% or below 5%. So let's say we have from one woman 45 years old 100 embryos, only five of them will be employed.
Okay.
That's why the success rate above 44 with IVF with your own eggs is around 2%.
I
And
totally.
uh,
Sorry.
only to add something, and that goes not only to the woman that sees 44 and 45, if the man also is above 45, then the semen also has genetic failures there. So that is also a factor. Women that are above 35, the ratio for abnormalities are higher, but the man also above 45, the ratio goes high from this one.
Yeah.
So I totally agree with Dr. Serafim. The accuracy of the PGT-A is something totally different. It has to do with the technique. This technique is well known in genetic laboratories. So yes, the PGT-A is 99.9% accurate. About the success rate, about the possibility to have a healthy embryo at the age of 44, 45. So yes, the possibility is low, is below 5%. However, we've seen spontaneous pregnancies at the age of 46, 47, leading to a healthy baby. So, yes, everything can happen, really. However, for the average of women at the age group of 45, 40, 44, 45, they have to try a lot. Really, they have to do a lot of egg collection. They need a pool of embryos in order to find if any of them will be exploited. So they need to be strong, really.
Definitely. Thank you so much. Indeed, I do believe again it was helpful and useful. And if you have anything else to add, you know what to do. Like two questions left, and we'll be finishing. So if you have more, this will be the final call for those questions. So go ahead, type those in, and let me just show you this question. So which PGT test would be best for screening for an embryo for an egg donor who tested for fragile X? Would that be PGT-M?
For an egg donor, which sensitivity test would be test for screening from an embryo for an egg donor? If the egg donor has fragile eggs, we don't. This is not a donor. We exclude this as a
Mm.
donor. So
Yeah.
we don't have a donor that has fragile eggs, of course.
It
Fragile egg.
wasn't it wasn't the list of the investigations I saw in my presentation. If a donor is a carrier of fragile eggs, she can't be a donor. However,
Mm.
which technique we will use, it depends on the genetic lab. They will decide. Usually it's PGDM, yeah. However, it's a matter of this is a question for the genetic lab. Even for us, we will give all the investigations to the genetic lab, and they will decide what they will do. But usually it's PGDM.
Mm. Okay, so that donor would not be accepted. Yeah, just to
Yes,
clarify,
of course. It
if
will not
there
be
is
done.
something that you see like this is not possible then in that case.
Also, if she has abnormal karyotype, also if she's a carrier of by disease, whatever, she will
Maybe
not be a donor.
Yeah.
something that
Okay,
is spoke to other countries because a donor from, let's say, Sweden can donate her eggs to someone in Spain. So the demographic stats must to be concerned about which which conditions are overall to all the people.
Yep. Okay, I think that's clear enough as well again. So thank you so much. And let me just go through another question. And this time we have Kathy would like to know, apart from prolactin, what other hormones need to be checked with blood tests to investigate an ovulation? This is our previous
For
patient.
yeah, yeah, for thyroid and androgens and
Okay.
for adrenal.
And progesterone, of course.
For androgens,
Okay.
so no over
Yeah.
androgens.
For the hormones.
Mhm.
But should be measured in very specific days if she wants to
Right.
be sure. That's why I mentioned that she need an ultrasound in order to see if something is growing in her ovaries, a dominant follicle, and then the very specific days she needs to do a blood test for progesterone, for LH, for estradiol, and at the beginning of her period, she needs to do prolactin, she needs to do TSH for thyroid gland. She needs a little
ACTH
bit,
for adrenal, for androgens. But if
yeah.
she hasn't any period for the last 7 months, then just to be sure, perform an ultrasound first to see the endometrium thickness, and then if the endometrium is not thick, do the exams.
Mhm. Okay. Again, I hope that helped. And of course, thank you so much for your question. Let me show you this question. So I had PGT-A testing and the result is no information could be given. So it is not recommended for transfer. What is the reason behind not successful testing? What
That
to do with such result?
That is according to the technique. Sometimes from the cells they are divided and they cannot do the PCR and to see the DNA from the embryo. That's why sometimes it happens when the cells have membranes and the DNA is inside these membranes. Sometimes they're broken. It's about the technique. So if that occurs, that means that we cannot test the embryo, we cannot perform an embryo transfer. That goes
And
also to a false parameter for every technique. It's also why after PGT-A there is no 100% survival rate of the embryo, it's 95%.
So it is a matter of laboratory and technician as well. You know, in Greece, only some IVF clinics can perform PGT-A because they have trained embryologists and they have trained geneticians who are in the genetic laboratory. However, sometimes it can happen because we don't have a lot of, let's say, cells from the embryo in order to have an accurate result. Okay. In that way, we have, in that case, we have two ways. The one is not to transfer the embryo, and the second is to rebiopsy the embryo. That means we need to thaw the embryo, take some cells again, freeze the embryo, and then wait for the results. But I want to say that this is very difficult for the embryo to rebiopsy the embryo because it has already a biopsy. It was frozen, then it should be thawed, then rebiopsy, then frozen again, and then thaw if it is healthy and use it for the embryo transfer. We have seen pregnancies after this procedure. However, this may be a problem for the implantation rate of the embryo. This may cause a problem to its ability to implant in the uterus. So, if she has other embryos, maybe think to use other embryos. If this is the only embryo that she has, maybe she should think rebiopsy, but there is a risk for the embryo.
Yeah. Okay. So there are many, again, different aspects to think about, yeah, before making that decision. So thanks a lot. I think it's again important to keep that in mind. It's not like a yes or no kind of answer as well, right? It's like not black and white, unfortunately. But thank you again for that. Let me show you a short question here. So do you suggest fresh egg donor or frozen eggs and embryo?
So it's a matter of choice. Faster, it's a donor egg that are frozen, of course, because a fresh donor, you have to find the donor first of all. In I'm talking about Greece, to find the appropriate donor, to stimulate the donor, and then we do all the process all together. Prepare the endometrium to the oocyte pickup, and then to see how many embryos we have at the end. But sometimes it's a little bit difficult to find the proper donor for the fresh. It's not very big of a difference for the success rate. Either it's frozen or it's fresh. The survival rates for it's nearly 100% for the frozen eggs, also for the fresh. So there's not much difference there.
I totally agree with Dr. Serafim, and in the literature, there is a lot of reviews that they support a fresh egg or frozen egg, fresh embryo or frozen embryo. They have almost the same success rate. It depends on the protocol, it depends on the preparation of the woman. So there are other things that they play a pivotal role, and not only the embryo, if it is fresh or frozen, or the egg, if it is fresh or frozen. So there's no big deal. There is no big difference between fresh and frozen.
Nowadays, there's nothing to, let's say, worry about. Yeah. So you can go for the fresh
Don't
and
worry about the
frozen.
frozen and the fresh. Now the
Exactly.
techniques in the labs are very advanced. They are not like 10 years ago.
Definitely. That's reassuring. Thank you so much indeed. But thank you. I think it's important because, of course, I'm sure it's like obvious for you, but I think it's really, really good to discuss it and just let our patient know that you don't need to be worried about that as well. Thank you so much indeed. Let me show you the next question here from our previous patient as well, previous question as well. So regarding the question, PGT-A euploid embryo obtained at 44, 45, the sperm side age is up to 35 and the embryo is planned to be transferred to definitely much younger surrogate. Women's endometrium lining is below 6 millimeters. That's why surrogate is discussed. Hope this helped for
So,
better outcome. Anything else you can advise?
yes, for some advice, do you mean the lining from the woman that says 44 is below 6 millimeters?
It looks like it, and that's why
First
surrogate is
thing,
discussed right now.
the
Yeah,
first thing to see is with hysteroscopy to see if the endometrium is okay there or there are any adhesions. This is the first thing. The second, I'm talking about if she want to use a surrogate. There is not only the lining thickness, it's only also the morphology of the endometrium. We have patients with Asherman. I had two patients with Asherman
mhm,
syndrome, so there was no endometrial cavity with adhesions. The lining, the thickness was 5 millimeter, but the morphology after the stereoscopy was perfect. Both of them became pregnant. So if this is the only problem
mhm.
for the surrogate, I don't know why they are going directly to surrogate. But it's not only the thickness, it's also the morphology.
I'm worried as well because there are many things that you can do in order to have a thicker endometrium, and we've seen a lot of pregnancies with endometrium below 7, below 7.5. So maybe, okay, I totally understand that maybe they have just one embryo, just one diploid embryo at the age of 44, 47, so 44, 45. So it's very, very important for them, of course. We are on the same page. However, I believe that she needs to investigate a little bit more why she has such a thing endometrium, and to use different protocol for the preparation of the endometrium, and then move to surrogate if there is no
If
Right.
there is,
change.
if
Okay.
also the morphology is wrong, so they have to go to surgery. This is an indication.
Makes sense. Again, thank you so much. I do believe it was helpful. Let us know if you wish to add anything else. And in the meantime, let me go to a different question from Natasha. I'm 40, considering donor eggs. Is it safe transferring two embryos? Will it increase my pregnancy chances?
Yeah. First of all, I have to ask why she is considering donor eggs. I think the ovarian, she has multiple IVF failures, correct, or
We
low
don't know,
ovarian
but
reserve.
yeah.
I don't know, but yes,
Mhm.
it is safe to transfer two embryos, but it increases the pregnancy chances, but along comes also the chance for twins.
Mhm.
And for a twin pregnancy, we have some more obstetric complications that we have to bear in mind. First of all, it's the age 40, so the percentage for preeclampsia is bigger. Uh, for a pregnancy, it's doubled. For gestational loss of diabetes, for a preterm labor. So if she's if she has donor eggs, if she has a excellent quality embryo, let's say AA, 4AA or 5AA, and of and she wants one baby, she can do embryo transfer with only one embryo. I had a patient 49. We did with donor eggs, and I only suggested we had three embryos, excellent, and then performed an embryo transfer with only one embryo to avoid the twin pregnancy.
Mm.
But if she wants two embryos from the beginning to have twins, okay, yes, of course, it is safe. If there are no other contradictions from the uterus, such as some surgeries or something that in the recent past history, yes, you can do it.
Okay, thank you.
So I totally agree with Seraphim. Yes, it can transfer too, but my advice also is if she has her first embryo transfer with donor, to transfer just one. So if the first transfer with just one embryo is failed, then okay, she can move to embryo transfer with two embryos. However, she should know that there are some risks with twins, and the most important is the premature labor, of course. Okay, so if she has no contraindication for twin pregnancy like thrombophilia or an autoimmune disease or a severe health problem, okay, but she needs very close monitoring during her pregnancy if she achieves a pregnancy with twins.
Okay,
That's the
again,
only.
But
yeah,
again, to just to make sure to have also to express a different opinion, it's not wrong to do a second embryo transfer again with one embryo if you have excellent quality embryos and you want to avoid the twin pregnancy. That's also it's not wrong.
yeah. Okay. There again, individual cases need to be in the. It has to be individualized, right? Every aspect of it. So of course we don't know whole story, so it's always better to just get that, and we will be able to help more. But I think that was again very useful for you. And now I will move on possibly to our final question for today. So if you have more questions, go ahead, type those in right now. And it's an interesting question. Let me show you. Any difference between donor egg with conventional IVF and donor eggs with ICSI in terms of cumulative pregnancy?
So a very good question. Because you only get what you ordered for the eggs and we don't want to miss any fertilization, we prefer to do ICSI. If we have when we're doing IVF in ICSI, okay, what is ICSI indications? It's the sperm parameter. But also if you have a low number of eggs. When we're going to donor eggs, we most likely have 7 eggs. This is not that many. So in order to have it all right done, we perform ICSI. Or it's depending on the sperm quality and the DNA fragmentation of the semen also.
Yeah,
Okay.
I totally agree. So it's better to have ICSI in order not to lose any fertilization because maybe the sperm will fertilize. Let's say that this lady will take about 8 eggs from the donor. Okay, so the sperm of her partner or the donor sperm maybe fertilize just the 6 out of 8 eggs. So when we have donation, we want the maximum rate of fertilization. That's why we prefer ICSI because we put the sperm into the egg. So we maximize the chances for the eggs to get fertilized. That's why we prefer ICSI.
Mhm. Again, thank you so much. I think that was crystal clear. And just to ask you, so do you perform ICSI in every cycle or not as well?
Not.
Mhm.
Uh,
Exactly.
we mean for donor eggs, one more
Just
minute.
in general,
In
in
general, no,
general.
no,
Yeah,
no, no.
exactly.
Let's
That's what
say
I
we have
wanted to.
plenty of eggs, we perform also IVF if the sperm is.
Mhm. Okay. Okay. Thank you
Or
so much.
if we have plenty of eggs, we can split some eggs with IVF, some eggs with
Right.
ICSI. So we see how the sperm and the eggs goes with one technique and the other technique.
Right.
It is individualized, really.
Definitely. Okay. Thank you so much again for answering that. And as I mentioned, looks like that was our final question. I do believe it was a very interesting session with lots of different questions. And so I do thank you so much, everyone, for joining and for all of your questions. Dr.
Thank you
Sarafim,
for
Dr.
having us.
Sophia, it was lovely to have you. Any final words before we finish for today? Anything else you wish to add?
The keynote here is that we have plenty of tools for infertility. Uh, Regardless the conventional IVF or ICSI, then an infertility problem comes, then we have also PGT. And then if that doesn't work, we have always tolerance. So in every step, we still have something to offer to our patients in order to get pregnant and have a healthy baby.
Yeah, and maybe the way is long to the baby, but it works. So be strong, and you will have your baby at the end of the day. One
Thank you
way or
so
another,
much.
you will reach your baby.
Definitely. Sometimes can take longer than usual, I'm sure. But yeah, thank you so much. I
Yes.
think it's the perfect finish for today. And thank you so much indeed. And of course, I want to add that if you would like to get some more answers, you can go ahead and just email me directly, and I'll be happy to forward any question to Dr. Serafim or Dr. Safia. But of course, if you want to get in touch with them directly, you can also do so. I'm sure they will be able and happy to help you out. Thanks everyone for joining, for your time today. And Dr. Sarafim, Dr. Sophia, it was lovely to have you. And of course, have a lovely evening. Really looking forward to some more events with you. It was a great session indeed. Take care, everyone, and have a lovely evening. And we will be back next week with some more events and some more topics. So thanks. And of course, if you wish to see this event, once again, you will be able to go to myevidences.com, and this event will be also available right there. Thank you so much. Take care. Have a lovely evening. Bye.
Have a nice
Thank
day.
you.
Bye bye.